Cancer, a disease often perceived as a solitary battle within the body, takes on a chilling new dimension when it becomes contagious. This is precisely the case with devil facial tumor disease, or DFTD, a devastating cancer that has ravaged Tasmanian devil populations. This aggressive disease, characterized by large facial tumors, spreads through bites during social interactions. The tumors often prove fatal, hindering feeding and leading to starvation. DFTD stands as a stark reminder that cancer can transcend the boundaries of the individual and spread like an infectious disease. The discovery of DFTD initially sparked a flurry of research into potential viral causes. After all, viruses, with their ability to insert their genetic material into host cells, were prime suspects in the search for a transmissible culprit. However, initial investigations failed to pinpoint a specific virus directly responsible for the disease. The absence of a readily identifiable viral culprit in DFTD led to the pursuit of other explanations. Scientists discovered that the cancer cells themselves were being transmitted from one devil to another. These cells, with their abnormal genetic makeup, were essentially acting as infectious agents. This finding, while groundbreaking, led to a downplaying of the potential role of viruses in DFTD. However, dismissing the viral link altogether might be premature. The question remains, what initially triggered the cancerous transformation in the first place? Could a virus, or perhaps another infectious agent, have played a role in the early stages of DFTD, setting in motion the cascade of genetic errors that led to transmissible cancer cells? This possibility, while not immediately apparent, warrants further investigation. The potential for viruses to trigger cancer is not a new concept. In humans, the link between certain viruses and specific cancers is well established. The human papillomavirus, or HPV, for example, is known to cause cervical, throat, and other cancers. Similarly, the Epstein-Barr virus, which causes infectious mononucleosis, has been linked to an increased risk of certain lymphomas and nasopharyngeal cancer. These examples highlight the ability of viruses to integrate into the host genome, disrupting normal cellular processes and potentially leading to uncontrolled cell growth and cancer. Given this established link, it is reasonable to consider that viruses or other infectious agents might play a role in cancers where the cause remains elusive. While the search for genetic mutations and environmental carcinogens dominates cancer research, the potential role of infectious agents often takes a back seat. This oversight could be hindering our understanding of cancer development, particularly in cases where traditional risk factors seem insufficient to explain the disease. Bacteria and fungi, too, should not be excluded from the list of potential cancer triggers. Helicobacter pylori, a bacterium known to cause stomach ulcers, has been classified as a carcinogen due to its strong association with gastric cancer. Similarly, certain fungal infections have been linked to an increased risk of specific cancers, particularly in individuals with weakened immune systems. Section 5. A double-edged sword: viruses in cancer therapy. Ironically, while the role of viruses in causing cancer might be underappreciated, these same agents are being harnessed as potential weapons in the fight against the disease. Oncolytic viruses engineered to selectively target and destroy cancer cells are showing promise in clinical trials. These viruses exploit the rapid replication machinery of cancer cells to their advantage, multiplying within the tumor and ultimately leading to its destruction. However, the use of viruses in cancer therapy is not without its risks. The potential for these viruses to mutate, revert to their pathogenic forms, or trigger unintended immune responses raises concerns. Furthermore, the long-term consequences of introducing modified viruses into the human body remain largely unknown. One researcher commented that it's absolutely insane to put a polio virus in the brain of a child with brain cancer. It's totally irresponsible and could have devastating effects for that child and their family as the virus sheds, especially since that virus has been eradicated in most populations and it could be reinserted for a therapy that is experimental at best. The same researcher says that it is irresponsible for any hospital, especially a cancer hospital where people's immunities are low, to be administering poliovirus. Section 6. The missing link. Where is viral oncology? The potential role of infectious agents in cancer, both as causative agents and therapeutic tools, highlights a glaring gap in our current approach to the disease. Cancer hospitals, while equipped with departments dedicated to surgery, radiation and chemotherapy, often lack dedicated viral oncology departments. This absence is perplexing given the established link between viruses and certain cancers. The lack of specialized viral oncology departments suggests a fragmentation in our understanding and treatment of cancer. It hinders the development of a comprehensive approach that considers all potential contributors to the disease, including infectious agents. Section 7. Expanding the search infectious agents as cancer triggers. The time has come to broaden the scope of cancer research beyond the confines of genetics and environmental factors. A comprehensive understanding of cancer requires investigating the potential role of infectious agents, including viruses, bacteria, and fungi, as triggers of the disease. This expanded approach necessitates increased funding for research into the complex interplay between infectious agents and the human host, with a focus on identifying potential mechanisms by which these agents might initiate or promote cancer development. Section 8. Conclusion towards a more comprehensive approach. The case of DFTD serves as a stark reminder that our understanding of cancer is far from complete. The dismissal of a potential viral link in this devastating disease highlights a broader trend of overlooking infectious agents in cancer research. Given the established role of viruses in certain human cancers and the emerging field of oncolytic virotherapy, it is imperative that we adopt a more comprehensive approach to cancer research and treatment. This includes acknowledging and investigating the potential role of infectious agents as triggers of the disease, developing novel diagnostic tools to detect these agents, and exploring innovative therapeutic strategies that target both the cancer cells and their potential infectious triggers. Only through such a multifaceted approach can we hope to unravel the complexities of cancer and develop truly effective prevention and treatment strategies.